Welcome to the deep dive. Today we're really plunging into the world of Neuralink, and specifically the impact it's having on Brad Smith. He's the first nonverbal ALS patient with their brain implant, and it's pretty groundbreaking stuff. Our mission here is to, you know, get under the hood of the tech, see how it works for Brad day to day from his own videos, and then zoom out a bit with Neuralink's white paper and some news coverage.
Exactly. And we've got some great sources lined up. We'll be looking at two YouTube videos from Brad himself. Really powerful stuff. One's called Elon Musk Makes ALS Talk Again.
Yeah.
And the other is Mr. Smith Gets a Neuralink Brain Implant.
Mm-hmm.
So very personal views there.
Mm-hmm.
Then we have the technical deep dive, Neuralink's own white paper, an integrated brain-machine interface platform with thousands of channels.
Right, the heavy stuff.
Yeah, exactly. And finally, a news piece. Neuralink shows signs of success and expands to Austin to give us that broader picture.
Okay, so why should you really lean in for this one? Well, look, this isn't science fiction anymore. This is happening now. What we're seeing with Brad and Neuralink, it's like a real-time look at the future of how we interact with computers. And the potential, it could totally change the game for people with severe disabilities. We're talking communication, independence, reconnecting. It's amazing tech solving a really deep human need right now.
Absolutely. And to really get why Neuralink is such a big deal for Brad, you need to understand ALS, amyotrophic lateral sclerosis. It's this devastating neurodegenerative disease. It attacks the motor, the cells controlling your muscles, basically. Movement, speech, even breathing. But, and this is the really cool part, the person's mind, their awareness, stays completely intact.
Yeah, that's just hard to imagine. A sharp mind stuck as the body declines. And Brad got to the point where he couldn't speak, totally relying on a ventilator. Before Neuralink, he used eye gaze technology. He called it a miracle in his video, which it was, in a way.
It was a lifeline, definitely. But it had
Yeah.
some, serious downsides, big frustrations.
Right.
Like Brad described, it worked best in dim light. He actually said he felt like Batman stuck in a dark room.
Wow, Batman.
Yeah. And any change in light could mess it up. So going outside, forget it. Attending his kids' soccer games, watching them swim. If he needed to communicate, the tech often just wouldn't work reliably out there.
Man, it paints a picture. Real isolation, even when you're with family. So when he signed up for the Neuralink trial, what was he hoping for? What were the big goals?
He was pretty clear about it. He wanted to control a computer cursor without that constant eye strain, to be able to click, drag, scroll, read at the same time, things we just take for granted.
Yeah, basic stuff for most of us.
Exactly. It was all about getting back some independence, being able to communicate, interact with his family, be present at those soccer games.
And Neuralink's tech is built for exactly that.
Right. The implant itself, for Brad, it's surprisingly small, like 5 U.S. quarters stacked up.
5 quarter. Okay.
And it's placed in his motor cortex. That's the brain area for movement planning and control. It actually replaces a tiny piece of his skull. Inside that little device, 1,024 electrodes.
1,000 electrodes.
Yeah.
And getting them in there, that's where it gets really futuristic, right? The robot.
Oh, absolutely. The surgical robot is key. It has to insert these incredibly thin, flexible threads. We're talking like 1/5 the width of a human hair.
Good fifth.
Yeah. And each thread has 32 electrodes. The robot places them just a few millimeters into the brain, and it has to dodge blood vessels, obviously, to minimize bleeding.
That precision seems impossible.
Well, the white paper says the robot can insert 6 threads. That's 192 electrodes every single minute.
Per minute. That's mind-boggling. A huge leap for neurosurgery.
Totally. So once it's implanted, it connects wirelessly, Bluetooth actually, to a standard MacBook Pro.
Okay, so the laptop does the heavy lifting, processing-wise.
A lot of it, yeah.
Yeah.
Brad showed this visual in his video. This matrix of green signals. That's the raw data from the 1,024 electrodes. They're capturing neurons firing every 15 milliseconds.
That's a ton of data.
Massive stream. So the computer's job is crucial. Figure out which signals matter for movement and filter out all the background noise.
Right. And it's important to be clear here, it's not reading his thoughts or words, is it?
No, absolutely not. It's a really key distinction. It's decoding his intended movement. The AI algorithms on the Mac analyze the neural patterns associated with wanting to move and translate that into cursor control.
Intention to move. Got it.
So initially, they tried having him imagine moving his hand. That seemed logical.
Yeah, it makes sense.
But interestingly, it didn't work that well for him. Through trial and error, the engineers figured out something else. For Brad, subtle tongue movements work best for steering the cursor
Tongue movements. Okay.
and clenching his jaw. That became the click.
Huh. So they really had to adapt and map his specific brain signals. How did he actually learn to use it then? Did he mention the training?
Yeah, he did. It involves focusing on moving the cursor to targets on the screen. Like little bubbles he has to hit and hold. Yellow targets are just hover, blue ones are a click.
Okay.
But what's really amazing is what he said happens after training. It becomes subconscious.
Subconscious, like using a regular mouse.
Exactly like that. He compared it directly. You don't think about your wrist moving, you just move the cursor. He thinks his years of computer use probably helped his brain adapt faster. Shows how incredibly adaptable the brain is.
That really does. And they have a way to measure this progress, right? The web grid thing?
Yep, WebGrid. It quantifies the decoding accuracy. Brad said his score with eye gaze was less than 1.
Less than one.
With Neuralink, he had a top score of 5. Big difference.
Wow. And you can actually try that grid yourself online, right? At Neuralink.com/webgrid.
That's the one. He gives you a real feel for the kind of targeting task he's mastering.
Cool. And they've built tools to fine-tune it for him, too.
Oh yeah, whole suite. There's bias correction. The cursor can naturally drift a bit because, well, the brain's always changing slightly. This tool compensates for that.
Huh. And he mentioned monkeys struggled with that drift.
Right. He said the monkeys in earlier trials would get frustrated by the drift and just give up. Humans seem better at consciously adapting to it.
Interesting difference. What else? Speed control.
Yep, speed control to set the baseline cursor speed. You adjust that a lot, apparently. Then there's more advanced stuff like friction and smoothing to tweak how the cursor feels.
And click stiffness, adjusting the jaw clench needed.
Exactly. It's all about making it as intuitive and efficient for him as possible. Really personalized.
Makes sense. And for typing, they built a special keyboard.
They did. A virtual keyboard. It suggests words as he types, which speeds things up, and it cleverly pushes other apps aside so he can see it clearly.
Smart.
Plus, he uses the standard Mac accessibility keyboard for shortcuts, copy, paste, select all, navigation, essential stuff.
And he even requested that parking spot feature. Seems small but useful.
Incredibly useful, yeah. Sometimes you just want to watch a video or rest without accidentally clicking things.
Totally.
So this little spot in the corner lets him park the cursor. He uses a specific dot sequence to bring it back. And apparently other trial participants love it too. It shows how important that user feedback loop is.
Definitely. User-centered design in action.
And speaking of communication challenges, typing can still be slow, right? Compared to thinking speed.
For sure.
So Neuralink created a chat app to help with that. It uses AI Growth 3 specifically to listen to conversations around Brad.
Listens to the conversation.
And then it generates potential responses for him, spoken in his own AI-cloned voice.
Wow. How well does that work?
He says it's not perfect, but it helps him jump into conversations faster, keeps him engaged. And sometimes it's surprisingly creative. He told this funny story.
Oh, yeah.
The AI suggested he get a bouquet of carrots for his friend's girlfriend, who loves horses.
A bouquet of carrots. That's brilliant. Shows the potential for AI to add some, well, spark.
Exactly. And they're still working on faster typing methods just using the cursor.
Right. And Brad himself, he used AI to try and build something, even without coding experience.
Yeah. He used Grok AI to learn some coding basics. He wanted to potentially build his own app for a new kind of single-finger keyboard layout.
That's incredible determination. Just dives right in.
It really is. And that AI voice cloning itself, that's huge. He worked with the company 11 Labs, used old recordings of his actual voice.
So he can sound like himself again.
Yeah. He admits it feels a bit weird hearing it after years of silence, but his family, his friends, they love it. And so does he, ultimately. It brings back a part of him.
So stepping back, the overall impact on his life sounds like it's been huge.
Oh, immeasurable, I think. He talks about more freedom, real hope. Communication is faster, yes, but also just richer, more varied. And that thing about going outside, not being trapped by lighting conditions like with the eye gaze.
The Batman quote.
I have been a Batman for a long time, but I go outside now. He said that's been a huge blessing. You can just feel the difference that makes.
Yeah, absolutely.
And he's interacting more with his kids. He even mentioned maybe playing video games with them soon.
That's fantastic.
Beyond all that, he talks about a sense of purpose. Feeling like being in this trial helps others. He's grateful for it, sees positive changes in his relationships, even his faith.
It's just, yeah, a really moving story. Incredible resilience meets incredible tech. Okay, Let's maybe shift gears slightly.
Right.
Let's look at the broader tech context from that white paper and the news article. What are the core pieces of the Neuralink system itself?
Right. The white paper gets into the nitty-gritty. So core elements,
Hmm.
those ultrafine polymer probes, the threads we talked about,
Okay.
designed to be minimally invasive.
Okay, the thread.
Then the super precise neurosurgical robot for putting them in safely and quickly.
The robot, yeah.
And third, the custom electronics. High-density, low-power chips right on the implant itself for amplifying and digitizing the signals right there at the source.
That miniaturization must be key for making it implantable long term.
Absolutely critical. And scalability seems like a big factor in their design too, right?
Yeah.
Handling lots of channels.
Yeah, they talk about high channel counts.
Exactly. Their System B configuration handles 3,072 electrodes. That's a lot of data points. And the underlying tech is designed so they could potentially scale it up further, maybe multiple devices, even in larger brains, without a total redesign.
Okay, back to that robot for a sec. The news article called it like a sewing machine for the brain, which is a catchy image.
Huh. Yeah, catchy, but maybe a bit simplistic.
Right. What does the white paper say makes it so advanced?
No, much more detail there. It's got a 3-axis stage, accurate down to 10 microns. Tiny movement.
10 microns. Okay.
A special needle pincher holds the threads. The needle itself is tungsten radium wire, strong, biocompatible, and the speed is impressive. It can insert and retract really fast, up to 30,000 millimeters squared acceleration. Helps make clean insertions.
Wow. And it can see what it's doing.
Oh, yeah. A whole imaging system. Multiple cameras, different lights. It guides the needle, actively avoids blood vessels on the brain surface, and verifies the threads went into the right spot. In animal tests, they hit an 87.1% average success rate for insertions.
87%. That's pretty remarkable for such delicate work. Really pushes past what a human surgeon could do alone.
For sure. It enables this whole approach.
And the electronics on the implant, how do they manage all that data processing in such a small space, low power?
Custom chips. They designed their own Neuralink AFIC. That's an application-specific integrated circuit.
Okay, custom silicon.
Right, tailor-made for this job. It has 256 programmable amplifiers converters. But the key is ultra-low power consumption, vital for an implant.
Makes sense. Need it to last.
Exactly. And even with thousands of channels, like in System B, all that data gets streamed out through a single USB-C connection to the base station for the heavy-duty analysis.
Efficient. And the white paper mentioned animal testing too. What did they learn from the early rat studies?
Those were crucial early steps. Showed they could implant these high-channel systems and get good, stable recordings over time, chronic recording. They reported high spiking yield. Basically means lots of electrodes were successfully picking up individual neuron firings.
Good signal quality.
Yeah, up to 70% yield on some arrays. That told them they were getting a rich signal, that the hardware and surgery were viable. It paved the way for human trials like Brad's.
Gotcha. So looking ahead, beyond helping people like Brad communicate, what else do they see this tech doing? What's the bigger vision?
Well, both the paper and the news article touch on big goals, restoring sensory function, restoring motor function.
Helping paralyzed people move again?
That's definitely a major goal. Also, potential treatments for neurological disorders, Parkinson's, dementia, spinal cord injuries, maybe combining Neuralink with other things like spinal stimulation.
Huge potential applications.
And Elon Musk talks long-term about making these interfaces affordable, reliable, available maybe even for enhancing human capabilities, not just restoring them. Big, ambitious ideas there.
Very ambitious. But with tech this cutting edge, there have to be challenges, concerns.
Oh, absolutely. And the white paper is pretty upfront about them. Long-term biocompatibility is a huge one.
How the implant holds up in the brain over years.
Exactly. The brain's internal environment can be tough on materials. Could the electrodes degrade? Plus, the brain's immune response. How do you stop the body from reacting against the implant over time and potentially damaging it or reducing its effectiveness?
Right, the foreign body response.
That's a major area of research. The news article also flagged this potential erosion, maybe needing replacements down the line. Big considerations.
Yeah, definitely. And that news article also mentioned Neuralink expanding to Austin, Texas. What's the significance there?
Growth. It signals they're scaling up, moving into a major tech hub to recruit more top scientists and engineers.
Tapping into that talent pool.
Right. And it kind of mirrors Tesla's expansion there, another Musk company. Suggests a bigger strategy. They're about 100 employees now, but Musk's mentioned a long-term vision of like 10,000. So they're thinking really big scale.
10,000 employees. Wow. Okay. And thinking back, the article briefly mentioned Gertrude the pig. That early demo, what was the point of that?
Gertrude was an important early proof of concept. Showed they could implant a device and wirelessly track brain activity in real time.
Just tracking activity.
Yeah, see signals correlating with their movements, eating. It validated the basic hardware, the surgery, the wireless link. But it's a big leap from just seeing brain activity to actually decoding it, like they're doing now with Brad, to control the cursor. That's a whole other level of complexity they've reached since then.
Right, decoding intention is the really hard part. Okay, let's try and pull this all together then. What are the main takeaways from this deep dive?
Yeah, I mean, it's clear Neuralink's tech is a massive step forward for brain-computer interfaces. And Brad Smith's story just powerfully illustrates that. Here's someone facing incredible challenges with ALS, and this implant is giving him a whole new way to connect with the world.
Truly transformative for him.
Absolutely. And the engineering behind it is just, wow. The tiny threads, the robotic surgery, the AI, it all highlights how ambitious this is and that they're getting real results already. And also, how they figured out the tongue and jaw control worked best for Brad. It wasn't just the tech, it was learning how his brain could best interface with it. That adaptability, that iterative process is key.
Yeah, that blend of advanced tech and understanding the individual brain, it's remarkable.
Yeah.
And it really makes you think, doesn't it? Considering Brad's experience and where Neuralink wants to go, what are the big questions we need to ask as this tech gets better, maybe more common? How could it change our ideas about, what humans can do, or even what it means to be connected? Definitely something to keep pondering long after we wrap up here.